Good morning, everyone. It is almost 9 o'clock on Sunday morning, and we are getting ready to do our race for healthcare today. And we will be doing a 5K. I probably won't be posting my my time, but I'm pretty sure my son Mitchell, who keeps training for these and is definitely going to be running today. We are in beautiful Interlochen, Michigan. We are on the campus of Interlochen Arts Academy, where we did an amazing interview last night. And if you didn't see the post, we also watched the concert of the Detroit Symphony Orchestra, which can be accessed online through Interlochen's website. And we'll be posting our education interview on arts education in the month of Education Focus, but you'll be able to see it on our YouTube channel very soon, The Nerdy Truth. So it'll be posted there shortly. But today is focused on healthcare, and what we're trying to do is to create a space and time and designated effort focus on health. Getting people moving. In politics, we spend so much time being negative and arguing, and we want to do something different. We want to get people running, walking, or rolling. I don't care how you do it. I just care that you get up, you do something, and do it for positive reasons for this country. But today is focused, because it's on personal health care, it's doing something great for yourself as well. And so we like that. So I'm going to start off this run today. Well, I call it a run, but I'm actually going to walk. I'm not a runner anymore. We lost that ability a while ago. With a couple of key stats to try and entice you to come and listen. So the first is we've been going through all of this literature. I've been interviewing people from around the country and trying to understand what's working, what's not in our healthcare. First thing to know, we aren't just the most expensive of the richer nations in healthcare. We actually are an outlier. In other words, we spend substantially more than any other country, and yet the studies show that we are actually the worst in our impact. Wow. We spend the most, we have the worst outcomes. Now, that's not to say that our physicians are poor, that our education is poor. We actually have some really great things that happen in our cancer research, in the way we treat heart disease, and a variety of other issues. But overall, our delivery, our coordination is incredibly problematic. And that starts to show up when you look through the system of healthcare. Interesting point. I've got a couple of interesting points I want to share. One of them is we spend $150 billion on missed appointments. Wow. We could recover that pretty quickly. Show up. Another thing, 86% of mistakes in healthcare are administrative. In both of these cases, we're losing money, we're losing time, and we're causing problems in people's healthcare. And all of it has to do with the system, not necessarily with the physician. Average cost per American depends on where you look. It runs anywhere from $8,600 to $10,000, and that's substantially higher than any other country. In Veterans Health, we spend about $6,000 per person, so there's a substantial difference in cost. The ACA, what we all know as the healthcare system through the government right now, gave 20 million people healthcare that did not have it before, but we still have about 10% of Americans that are uninsured. And so this does add to cost and add to issues with hospitalizations and other things that could be avoidable. Pharmaceuticals, this is a hot topic. Looked up a lot of information. I'm actually going to post, and you'll see it in our national healthcare strategy, some information about the flow of how pharmaceuticals are actually, pharmaceutical companies and the management programs are making money. It's actually pretty shocking, very informative, and clearly gets at the point that we've got to have a smoother system, and that the control needs to be improved. I like a 2020 button. We haven't gotten to buttons yet, but we've gotten to t-shirts. In fact, I'll segue just for a minute. I have the t-shirt on today. Life is short, live it, be it, do it. This is one of my personal mantras. I know it's kind of hard to see it in the shirt, but you can now go online to teamjjusa.com, and we actually have a shop button that you can go to, and we have all our shirts and our runs all available there, so you can access it. In fact, it all got uploaded and finished last night, so we're really newly sharing this information. So if you'd like to start there, that is a great place to start. Couple other things. So pharmaceuticals, this has to be dealt with, and has to be dealt with at the system level. It's not necessarily that we have problems. We do have some FDA issues with approvals, but that gets into some risk reward places where we have to think. Found a lot of information on how to deal with rare diseases and how we can use our modeling and simulation programs to be able to use big data to get us access to and improvement in the area of rare diseases. So I'm excited to share that. Another big area that we focused on was prevention and looking at those areas of healthcare where we all, each and every single person, can have an impact. I know I'm not saying anything anybody doesn't already know, but our overweight and obesity rates are at 75% for men and 68% for women. You know, obviously this is a major issue. We still have about 15% of people that are smoking, also another issue. One that is starting to get a lot of attention is suicide. What surprised me was the gender breakdown. There are significantly more males that commit suicide than females. And this may have to do with attempts versus results. But nonetheless, it is our older male, our 75 and older range that has some of the highest rates. So something to really consider. And when you start looking at that as a whole, here's where I land. Number one, we have to focus on prevention. We've got to get a culture shift in this country to really focus on wellness care and the way that we approach that. The second thing that we need to focus on is connection. We need to think of healthcare as an ecosystem. Everything from our doctors and hospitals, but also to our administration and delivery processes. And then the third point that we need to look at is going to get into that specific delivery space. How do we make it easier, clearer, more simplistic, and much more efficient so that we get the effectiveness that we need for this country? So I'm going to switch over now to an audio recording. I will record it now during my run. Why? Because my brain works best when I'm moving, and so does yours. So I hope you all will take the challenge, go online, teamjjusa.com, sign up for the run. You can do it anytime. We have our recordings from our National Environmental Strategy where you can get commentary on that one. Shortly soon, we will be able to upload, access the commentary on healthcare strategy. You also get a t-shirt and you get a medal for the country, so it's a worthwhile activity. And so I hope you'll go online, sign up for it, get your t-shirt, get your medal, get your commentary, and do something for yourself and do something for the country. I mean, if nothing else, do something positive for politics. All right, I'm going to get on my run. I will be uploading this a little bit later, and so stay tuned. And one last plug that I forgot to say, our National Healthcare Strategy will be released by midnight on the 31st, so stay tuned.